Please welcome Manny.
All right, thank you, Claire, for that very, very nice introduction. I actually get to start, again, I'm Manny Pastreich, the president of 32BJ. I get to start, actually, Claire give me the honor of thanking some of the people who are with us today. And I really want to start with some of the elected officials who are with us. Senator Liz Krueger, Assemblymember Chantel Jackson, and Councilmember Julie Menon, who have been real fighters for taking on the healthcare cost issue for all of us. So if we give them a round of applause, I would appreciate it. I would also just say that this started in New York, but we have moved to New Jersey, and we're very, very happy today that we'll have the New Jersey Lieutenant Governor candidate, Dale Caldwell, with us as well. We have representatives from the New York City Office of Healthcare Accountability, which you'll hear about also, and the Office of Labor Relations, and the New York State Budget Division. And then we have our partners who have really worked with us, because this is something we have learned that can't be done alone. So in New Jersey, we have the New Jersey Education Association today, the New Jersey Firefighters Mutual Benevolent Association, the Communication Workers of America, New Jersey. And from New York, we have District Council 37 of AFSCME, the Community Service Society of New York, the Hotel Trades Council, the New York State Nurses, the United Federation of Teachers, the Small Business Majority, Citizen Action, and New York PIRG. So if we give it, that has been a group that's moved things forward. If we could give them all a round of applause as well. And I also would be very remiss if I did not thank Howard Rothschild, who's the president of the Realty Advisory Board. I think there's lots of coalitions that need to happen, but I think probably one of the most important coalitions, which we're very happy to have him and our guest speaker today, is how the business community comes together with labor, with community, with healthcare advocates to make these changes. And so to have Howard adopt these issues and work with us has been incredibly important. So Howard, thank you for being here as well. And lastly, Claire said it, but I want to give her thanks to Claire Brockbank, Cora Opschel, Misha Sharp, Peter Goldberger, and Steve Jenkins, and the entire Health Fund and Health Policy team. If we could really give them one more round of applause. We'll probably do it many times later, but thank you. All right, so again, I'm Manny Pastreich. I'm the president of 32BJ. We're a 175,000 member union of janitors, doormen, airport workers, school workers, security officers, the folks you see in the lobby protecting buildings. We are the essential workers that keep our cities running and moving. And so probably some of you are saying is, why is the president of a janitors union here today and so deep into a healthcare pricing thing? Why is the head of a janitors union taking on these big hospital conglomerates on this complicated issue? And if I'm honest, I often ask that question of myself. There's lots of people here who know a lot more and should know a lot more about healthcare than I do, but I've had to learn a lot. And I guess I'm going to try and answer that question in the next couple minutes, but I would urge you, if you run into one of our 90,000 members, if you're a New Yorker, I'm guessing you have because they're all over, or if you're from outside New York, and ask them, what do you think of the union? And I'm guessing you'll get one of two answers, I hope. This is my hope. You might get a little complaint about one of their grievances, but if they're tired, I think they'll say the difference that the union has made is, number one, I've been able, on my janitor job, my doorman job, to afford to live in one of the most expensive cities in the world. And the second thing they might say, or they might say both, I hope, is I really appreciate the health care that my job provides, the family health care with no deductibles and no premium sharing. I've come to depend on that through my career. So I still haven't answered your question of why I'm here, but I would say that part of the answer to that is an internal struggle that the union has over those two issues, wages and health care. The first thing we get into is a battle. I'm trying to speak carefully because Howard's here, who I negotiate with. But we get into a battle with Howard and the building owners about how we make the pie bigger. And I can say that I am very proud of myself and our predecessors as a union, what we've achieved. I think if you look over probably almost any single year, but any 4-year contract cycle, the gains that we've won have exceeded the cost of living in any one of those cycles. So we've made the pie bigger. We've achieved great things for our members, for the essential workers that make this city work. But what happens is we go through that battle. We have our fights with Howard and the real estate industry. And then we have to figure out, how do we break it up? And that's where that wage healthcare conflict comes into play. And if you look over the past decade, 40% of all the pie bigger, of all the increase in compensation that we've won, has gone to pay for healthcare. And that's largely for one reason: the rising cost of hospital prices. If hospital prices had just kept up with inflation during that same time period, our members would have $5,000 more in their pockets in wages. And $5,000 for someone who makes $50,000 trying to live in New York is very, very significant. So it became crystal clear to us, that, and I do want to again give credit to the employers, because they also saw how this issue was spilling over into bargaining, that we had to dig in our heels so that workers who keep New York City running don't have to choose between going to the doctor and putting food on their table or paying their rent. That's an unacceptable choice, and it became our responsibility to do something about it. So over the past few years, we decided it was time not to fight with ourselves, but to change the rules, and that's why we're here today. The 32BJ Health Fund has been steadfast in their determination to uncover opportunities to lower the cost of health benefits without compromising quality. That's why our health fund created the maternity program, where our members can get prenatal delivery and postpartum care at top-notch hospitals on their $40 copays. That's why we developed a preferred, non-preferred copay structure that helps us get members into the best hospitals that have reasonable prices. And we know that quality healthcare is possible for working New Yorkers at a fair price. We do see that in certain places. But we also know there's real big barriers to achieving that. There's rampant anti-competitive behavior. There's a lack of transparency, although I will say we've made some progress. And we're facing massive hospital conglomerates that put profits over people. Here's the reality. Our health fund does everything in its power. It's a great team to design excellent premium free benefits for our members here in New York. Some of the wealthiest hospital systems at the same time are continuing to leverage their market power to price our members out of care. And Claire touched on this, but it's one of the most important things that helped me come to this issue and my willingness to take on. One is there is not a correlation that if you pay a high price, you get quality. Because if there was, we would figure out how to pay a high price for our members so they got quality health care. But there is no direct correlation between price and quality. And the other one that's important to say is this is nothing to do with a fight with the people who work in hospitals. They're great. We love the nurses, the doctors, the people who make the hospitals work. And again, there's no correlation between what a hospital is charging in price and whether workers are being treated fairly. There's many, many 1199 happy union members at low-cost hospitals. So those were two important factors that helped us get there. And so once we got over those humps, that's when we launched the hospital price campaign nearly 5 years ago. And we are committed to using every lever at our disposal to make sure workers and their families aren't taken advantage of by hospital corporations. Hospital corporations that are more concerned with lining their pockets than keeping New Yorkers healthy. For over a decade now, New York's wealthiest hospital systems have increasingly bought up other hospitals and independent doctors, slap a new sign onto the front door, and raise their rates, claiming it was a hospital instead of a primary care facility. Through consolidation, a handful of New York health systems have amassed enormous wealth. As their monopolization of the market grows, so does their ability to assert dominance in backroom contract negotiations with the insurance providers. The dominance allows them to demand higher prices, but it also allows them to ensure those contracts include anti-competitive terms that can dictate how health funds like ours design their benefits. And I have to say, there's no system that's more egregious in their pursuit to prevent our cost savings than New York Presbyterian, who in the 2023 reported a total net assets of $12 billion, and that's an increase of 86% since 2016. Now, if they were a bank, those would be really, really good numbers they should be proud of. But this is a nonprofit hospital that's mission is to help New Yorkers stay healthy. So that makes it somewhere between inexcusable and unconscionable. I'm sure many of you read the New York Times reports that last summer the New York, and I'll call them NYP, has been investigated by the Department of Justice for those same anti-competitive practices. Last year I stood on this stage and shared that NYP had recently prevented us from switching to a new insurance carrier that could have saved our health fund millions of dollars, and that they plan to use the upcoming contract negotiations with Anthem to force their way back into the network. I told you when we plan to fight back, as we have many times before. Our members took to the streets, and through very clear public demands, at a minimum, we managed to keep NYP out of our network, which is a crazy fight to keep someone out of the network. But that victory really is just about short-term fixes to the problem. Without competition, NYP can and will continue to charge exorbitantly high prices without fear of losing business. Without competition, NYP will be incentivized to change these will not be incentivized to change these behaviors or change their pricing. So we have to control the terms of our contracts, and you'll hear about that today, or these systems will continue to have the upper hand. Today you'll hear from some of our friends in City Council and the legislature about the way New York City and state can play in keeping healthcare costs down for all New Yorkers. You'll hear from experts in other states who've actually done it, used government to take crucial steps to rein in out-of-control hospital prices. You'll hear from our coalition partners in New Jersey about forging incredibly unlikely but powerful alliances to take on the healthcare industry affordability crisis. And you're definitely going to hear from a savvy, successful entrepreneur about his game-changing efforts to change the industry. And you'll hear from our health fund about the journey they've been embarked on, about how we're working to make sure that these big companies can't dictate the provider contracts, and we keep these provider contracts focused on our members, not the big hospitals. So 32BJ is no stranger to tackling tough challenges. It's never been easy, and we've learned that nothing worthwhile is easy. But as I stand before you today, I can say without a shadow of a doubt that the unprecedented wage increases that we've achieved for our members is a result of the kind of work that we're doing today. And that makes it all worth it. I know many of you here have that same determination to keep on taking on the healthcare industry, bringing down costs, increasing accessibility. And my hope is that you leave here today with a renewed faith that when we take on this fight together, we win. We ready to go? All right. So as Claire said, this is the fourth. I think it's the fifth if you include our first online conference that had about 100 people. And it's obviously the biggest, and I think one of the reasons is because Claire and the team are amazing, but the other reason is they were able to get one of the biggest names in healthcare right now, and I'm very excited to introduce him now, our keynote speaker, Mark Cuban, who's going to share his experience developing direct purchasing models to reduce healthcare costs. Among the many impressive endeavors, and I'm not going to go through them all because it's just an incredibly long list of accomplishments, Mark co-founded Cost Plus Drugs, which was launched in 2022 with transparent pricing and limited markup that fundamentally changed the pricing of medication in this country. I'm a union guy, not a business guy, but I can definitely appreciate a man who started at 12 years old selling garbage bags to make money and has never looked back. And it's his commitment to changing our broken healthcare system that really has driven the deep respect that I and our entire team have for him as we've watched him over the years. He recently said, over time, we'll change the system, not only for our members, but the entire country. And that's the kind of vision that we can all get on board with. So I'm truly grateful to have Mark Cuban with us today. Please join me in welcoming Mark to the stage.
Thank you. Claire, thanks.